My name is Brandy, and today I will be demonstrating mechanical traction, specifically cervical traction, in the treatment of a patient with whiplash. The patient had the car accident 2 months ago and still complains of muscle guarding, pain, and spasming. So cervical traction can be good for this because it lessens the pain by interrupting the pain cycle and also promotes relaxation. When considering cervical traction, you want to consider contraindications and precautions. Contraindications are acute injury or inflammation, fracture or recent surgery in the area, uncontrolled hypertension, peripheralization of symptoms, which means the pain radiates further away from the body during the traction, and hypermobility or instability of the region. In terms of precautions, you want to consider claustrophobia and disorientation, discomfort with laying supine or prone for the treatment, a medial disc protrusion, a displaced annular fragment, and then specifically with cervical traction, you want to consider TMJ and dentures. And if there's diseases of the spine like rheumatoid arthritis, that's also a precaution. And lastly, if pain immediately goes away with the use of traction, that is a concern. So today I'm going to have before I have my patient come, I'm going to insert the cervical traction unit into the machine and do the rope release to insert into the slot. And then I'm going to hold this secure before I bring the rope back. Then I will go ahead and have my patient come lay in supine with their head inside the neck cradle, and you want the cradle to be just below the mastoid processes. Then I'm going to use the strap to secure their head comfortably and make sure that doesn't bother them, and then use this knob to tighten the traction unit around the mastoid processes, leaving about 1 inch or comfortable wiggle room for the patient. Once in this position, we are going to adjust the parameters. In order to treat muscle spasm, we're going to do a 20-minute intermittent treatment of a low load, which would be 11 to 15 pounds for cervical. We're going to go ahead with 15. And then because it's intermittent, it's going to be a 5-second hold and a 5-second relax for the 20 minutes. I can edit all of this on the parameter screen, which has already been done. And then before I start the treatment, I will provide the patient with the emergency stop button in case there are any adverse reactions. And then once everything has been set up and I've checked that the patient is comfortable, I will go ahead and hit start. And then I'll check with the patient in about 5 minutes for comfort or any adverse reactions to the treatment. Lastly, before you treat, just to be extra precautious, you want to make sure that you have locked the table for the treatment.